Hello, Dr. Kevin Connors here with section 17 of my book, Stop Fighting Cancer. Hopefully, you're learning something, you're getting something from this to take back to your doctor or whoever you're working with. Um, really, again, we're doing this because I know that we can't help everybody that's out there. We just don't have space in our office. It's not impossible. I mean, it is impossible. And I know that, not everybody can come to our office. So we're trying to be a blessing. Remember we talked about the bias that's out there, taking advice from biased people, and I said that I have a bias too. My bias is I want people in my office, and I need to make a living, and but I'm giving away a book, and I'm giving away a program to people I know that will never come in my office. So please understand, I have no bias other than you getting better. So I just want you to make the best decisions. I want you to be able to have enough wisdom to take it before the Lord so that He can lead you in the right way. And I want you to have success ultimately. So take this information to your doctor. I mean, he probably won't know what to do with it. So, but maybe you have a naturopath or some natural medicine doctor or functional medicine doctor that you can go to that maybe can gain some wisdom from this and help lead you in your course if you're not able to um, to do it on your own. So ultimately, that's what I want for people. So um, please be appreciative of what we're trying to do here. Support us as much as you can with prayer, I ask. In this section, we're talking about boosting your immune system. And what we're talking about with your immune system is we want to boost your Th1 side. So this little teeter-totter shows this person has a hyper Th2 side. And this is what usually happens, if you remember the previous sections with cancer patients. They're Th2 dominant at the site of cancer. And what happens with chemotherapy patients. So a chemotherapy patient, somebody who's going through chemotherapy or went through chemotherapy, will be Th2 dominant everywhere in their body. So their immune system, their killer side of their immune system, is extremely suppressed, if not completely in the pits. That's why if you've gone through chemo, they have to measure your white blood cells before they give you another chemotherapy, because if it's really in the pits, they could kill you with the chemo. So they have to sometimes wait a few days or weeks or give you some medication that will stimulate, an immediate immune response to be able to administer the next chemotherapy drug. That's the negative of chemotherapy, is it just shoots your immune system, because that's a rapidly replicating cell structure as well. And that's what chemotherapy targets. So we need to stimulate an immune response. Now, in this section, you're going to read about a whole bunch of different things that will help boost that Th1 side of your immune system. Maybe the greatest thing again is food, but there's a lot of different supplements that you can use to stimulate that Th1 side. So read through this stuff and make sure in any supplementation protocol. I mean, you can always go to our website and go to our store and purchase some of the stuff from Designs for Health and other things that we have in our personal store. There's nothing illegal or anything about doing that. I encourage you to do that instead of buying some cheap stuff at some pharmacist store that doesn't really know anything about supplementation. When you're talking about herbs and supplements, you don't want to buy synthetic. You don't want to buy herbs that are just cheaply grown. Unfortunately, maybe fortunately, there's no FDA guidelines on this, so you have to trust a good company. So most of the companies that sell solely through doctors are good companies, and I'd recommend those. So you can look on our website if you so desire to purchase that way. But um, this will give you a good list of a lot of immune stimulants. So I hope you enjoy this section, and I will see you soon.